So thank you everybody for joining us. We are wrapping up. This is December. This is the 2019 Integrative Wellness webinar series, video webinar series and education program for EDS Wellness. I am Kendra Nielsen-Miles. I am the executive director and founder of EDS Wellness. As you can tell, I'm a little tired. We've been doing this webinar series for about 2 years now. So the fact that it's December, this is about the second year that I've been doing these webinars, and I love them. I love having everybody with everybody that we have that is speaking with us. I love doing the Q&As with Dr. Dempsey, and I love working with Brianna, who is a physician's assistant. And just so you know, we are here to talk about holistic pain management.
Yes.
Brianna, for those that were waiting for us, Brianna teaches. So she's a physician assistant, and she was teaching, she's a professor. So we were running into a little bit of just a delay in getting started. And so everybody, thank you for being patient. So
yes,
we're here to talk about holistic pain management. We're so happy to have Brianna again with us for the second time to talk. First time she talked about CFS leaks. This time we're going to talk about holistic pain management. This is because this is her forte. This is what her specialty is as a physician assistant. However, she's also a patient. So we come at it from a different perspective. We kind of debated on how best to really present this webinar, because this is not a directive. We are not here to give medical advice. This is educational and informational purposes only, as I say for every webinar. And because she's a patient, she comes with a special circumstance. So she's going to present her story again, just like she did for CFS leaks. And she's also going to just share what works for her with some clinical basis in the background, which I think is incredibly helpful. Her webinar earlier, it was in the summer, was very informative. It was probably one of the best webinars in terms of just people understanding and also getting the patient side and the clinical side. And it was very well received. So we're going to present it just like that again. But just remember, educational, informational purposes only. We are going to do more of a kind of casual, she does have some slides, but we're going to do kind of a casual Q&A. So if you have questions, please ask underneath either the live feed on the EDS Wellness page, or in the chat, or in the Q&A on Zoom. And if it comes up and it's pertinent to what she's talking about, I will ask it. If not, we'll wait until the end. And just so you know, for those, there was a question on Zoom, if you are muted. So everybody is muted. The only volume or only voice or sound you should hear is either Brianna or I, and also visually. So if there's any problems with that, please let us know. But otherwise, you are muted. Your questions will be handled in the chat, via text, and also Q&A, and then under the live feed. Brianna is also broadcasting on Instagram Live via her page, which is called Healed and Empowered. And with that, we're just going to go ahead and get started.
Perfect.
So thank you for everybody joining us. And I'm going to go ahead and mute my mic and my video. So thank you again. Thanks for those that gave to Giving Tuesday. Thanks for bearing with us for 2 years of doing this educational series and webinar series. And I look forward to next year. And thank you. If there's any comments, questions, recommendations that you have for next year, I'll probably state a little bit at the end what my plan is, but please ask, please state, please give me your recommendations, and I'm ready to rock and roll. All right. So thank you, Brianna. Please do give a proper introduction for yourself, since I was trying to like breeze through it really quickly because I knew that everybody was waiting. So.
No. Thanks so much for the introduction, Kendra. And then for everybody on Instagram Live, thanks for joining. I'm doing a webinar currently live with EDS Wellness, Kendra Nielsen-Miles. So you can find her page on Instagram at EDS Wellness, or mine at Healed and Empowered, for those of you watching on Facebook. Thanks so much for joining this webinar tonight on holistic pain management. For the people that are joining on Instagram, they couldn't hear anything you said, Kendra, so that's why I'm giving like a brief introduction. But for those of you who don't know me, my name is Brianna Cardenas. I am an assistant professor at the University of Laverne. I am also a certified athletic trainer and a physician assistant. I am a patient living with EDS as well as the spinal CSF leak. And I also have my clinical expertise in chronic pain management. So that clinical background comes a lot of trial and error from the patient perspective, but also a lot of scientific evidence and support for why I make the decisions that I do to manage my pain holistically. And I think a lot of people tend to think of holistic pain management as basically like essential oils and like 3 chakra meditations a day, and then like your pain goes away. But that's not what it means. I'm going to add EDS Wellness to my story. Go live with EDS Wellness. Great. So Kendra's joining us via Instagram Live now on EDS Wellness. But essentially, holistic pain management just means that we're taking into account, taking into account, sorry, just a second. Kendra, would you mind muting your mic on Instagram? Oh, sorry, she left. But essentially, holistic pain management means we're taking into account the whole person. So that doesn't mean that we're just focusing on the physical side, we're just focusing on medications, or we're just focusing on like interventional pain management, like shots, injections, or things of that nature. But it's really taking into account all of the pieces of what I guess the profile of wellness would be for the management of pain, not the cure of pain, not the cure of disease, because I think a lot of people with EDS will tell you like this disease isn't going away. And really the goals that we have in mind are just to be able to manage our pain as best as possible. So as Kendra stated before, and for those of you on Instagram, nothing that I'm sharing today is medical advice. It's really meant to give you insight into what I do to manage my pain, with the scientific background and support for why I do that to manage my EDS. And everybody's body is different, so what I do may not work for you, but I definitely want to be able to share with you what I do, so that way you have some, I guess, some guidance as you embark on your pain management journey as well. So I'm adding Kendra here to the live Instagram once more, and let's go ahead and move on with the webinar. So it's really important to make sure that we understand what's causing pain. So a lot of times there can be a disease process. So the disease process itself, whether it's EDS, whether it's an autoimmune condition, whether it's one of the many comorbidities that EDSers face, that disease process in itself is often a pain generator. But one thing that I've found that helps me kind of down regulate the amount of pain that I'm in is controlling inflammation. And inflammation is really what's going to cause the progression of disease, and often what causes the increase in the pain experience that we feel. So ways that we can manage this are going to be multifaceted. So managing pain can include diet, supplements, medications, but I've found that calming down the nervous system, which is pretty much where our body experiences pain, is the best way to be able to kind of get a handle on all of the different things that are going on simultaneously, especially when we have a disease process that affects multiple parts of the body. So on any given day, people with EDS can be dealing with pain in multiple joints. They can be dealing with intestinal or gastrointestinal pain. They can be dealing with headaches. They can be dealing with problems with their jaw, problems with, multiple aspects of their disease state, which often puts our body in kind of a fight or flight mode and activates what's called our sympathetic nervous system. And that really doesn't allow our body to heal or repair. So calming down the nervous system and putting it into what we call a parasympathetic or a rest and digest state can really help to facilitate healing, facilitate calming down some of that inflammation, and then ultimately get a better handle on the pain. So calming down the nervous system can take many forms. So for me, it's sometimes just catching myself when I am overwhelmed with anxiety, with pain, with some of the things that I have on my plate, whether it's like work stress or whether it's scheduling multiple doctor appointments and trying to get my insurance to go through and trying to manage all of the just stressors of daily life, whether that's dealing with kids, dealing with just all the things that life throws at us. And by just being aware of what's going on with our bodies, checking in with ourselves and saying like, hey, why am I feeling so out of my element right now? Or hey, why am I feeling so just off my game or uneasy or overwhelmed? Just taking a moment to pause, deep breath in, let it out, to calm down the nervous system and give your body a chance to check in, be aware of what's happening in your nervous system, and try to shift into that parasympathetic state. So the easiest way I find to do that is by taking a few deep breaths. If you exhale for 1 count longer than your inhale, that actually starts to turn on your parasympathetic nervous system and will shift you out of that fight or flight mode into parasympathetic state. And I will be the first to admit that when I started on my multidisciplinary healing journey, especially being a very scientific, analytical person and coming from like a traditional Western medicine background, I would have laughed in your face if you would have told me that meditation would have helped me. I thought it was very like woo woo, and I thought it was very I was very skeptical of it. Like I just thought that people were kind of blowing smoke at me. So when I actually tried it and actually bought into it, so to speak, and gave it an opportunity, and I figured, hey, what the heck, it's not going to hurt me to try it. Once I actually started embarking in that meditation journey, making a point to do it on a daily basis for at least 10 minutes, it made a huge difference in my healing. And I felt like it gave me better awareness of my triggers, better awareness of when I was pushing my body, or even when I was just being overwhelmed and pushing my mind, so to speak, further than I was ready to do for that day, or more than what my body could handle that day. And that was super duper helpful. So calming down your nervous system, whether it's with prayer, with meditation, with just taking a few deep breaths, doing biofeedback, going to therapy, whatever the modalities are that work for you, that's really what I've found to be super helpful for me. So therapy honestly has been key for that. My favorite guided meditation channel is called The Mindful Movement on YouTube, and they have multiple meditations for pain, for sleep, and then also being able to just stop and reflect and process with my husband, who's very supportive, and just being able to talk about how I'm feeling, which was kind of a foreign concept to me. So all of those things in combination help this whole process feel less overwhelming, because I think with EDS, there's a lot of grief, and being able to acknowledge that, process that, and then be able to move forward rather than being like so resentful about having this disease, or so resentful of like how that doctor treated you 5 years ago, or whatever the case is. Kind of alleviating some of that burden and taking that off your mental plate, so to speak, has been incredibly helpful for pain management for me. So another thing that's super duper helpful for me, and again, is another thing that I 10 years ago would have been like, LOL, that's super stupid. Like, please don't like tell me that eating salad is going to cure my EDS. Like, I would have been the first person to say like, that's not for me. But what I have found is that by eliminating certain foods out of my diet, or trying to mitigate them to consume in the smallest amount possible, it's been incredibly helpful. And part of the reason behind that is if we're eating foods that are inflammatory to our body, it contributes to the overall inflammation in our system. So if, for example, your body has X number of spoons, I think for all of us with chronic illness, we're familiar with that spoon theory. If we're using 2 or 3 spoons a day just to try and process the food that we're putting in our body, because either we're reacting to it or it's causing inflammation, like those are spoons that could be going towards helping heal joint pain or helping with other inflammation, like from a neuroinflammatory or a nervous system standpoint. So once I gave it a try, it actually made such a profound difference that like I'll never go back. So at first it was really difficult to break up with things like dairy, because I love cheese, I love butter. All of those things were super duper tasty, but doing an elimination diet for 30 days where I cut out all of these, I actually did what's called a Whole30. And I did it through a company called Arbonne, but I did a Whole30 diet because it was like a fitness challenge. And then when I started reintroducing food groups after eliminating the foods listed here as basically that 30-day period, once I reintroduced those foods, it completely brought all of my joint pain back. So it was a huge wake-up call to me that like, oh my gosh, putting these foods in my system is really causing an exacerbation of my disease state, and certainly an exacerbation of my pain. So the top inflammatory foods are dairy, gluten, sugar, and alcohol. So if you're not to the point where you're like, oh my gosh, like I can't give up dairy, or I'm not ready to give up bread, or whatever it is, try one at a time, because not everybody is gluten intolerant. Not everybody is sensitive to dairy. It takes kind of a trial and error to find out what helps best for you. Going a little bit further into like high histamine foods, those are typically foods that are like aged. So if you think of like smoked meats or, aged cheeses, those kind of things tend to be high in histamine content, as well as fermented foods like kimchi or other types of jams or preserves, etc. High foods, or foods that are high in lectins, are things like legumes that basically have a particle in their skin of the food. So like legumes, and then foods with seeds in them, cucumbers and things like that. It's actually like a small toxin that the plant produces, or the food produces, in order to ward off animals and other predators from eating them. So that's why it can be really inflammatory to eat beans or to eat things like high lectin foods. And that one was pretty hard because for the longest time I was like using hummus as a butter substitute, for example, or as like a cheese substitute, using beans to find my protein supplements. And that was a really hard one for me to give up, but it really, really helped with abdominal pain. It helped with bloating. It helped with abdominal discomfort. So I just basically avoid legumes whenever I can or lectins, excuse me, because they really do tend to flare me up surprisingly more than I thought they would. And then lastly, nightshade vegetables are potentially quite inflammatory, especially for people with autoimmune diseases like rheumatoid arthritis or lupus, which a lot of people with EDS also have overlap of those autoimmune conditions. So things like those nightshades can be super inflammatory. Tomatoes, potatoes, eggplants, and peppers are the foods that are in the nightshades. Sweet potatoes, however, are foods that you can still eat. So if anyone wants a list of these, I'm happy to send like a more in-depth or detailed list of what these foods look like. But there's some really great options to look at as far as different Instagram accounts to follow, or Pinterest recipes that are out there. This is a post from Dr. Mark Hyman's Instagram, and that's a great account to follow because they get lots and lots of tips on low inflammatory lifestyle as far as different foods and tips and tricks that are helpful from a dietary standpoint. Let's see. All right, and moving on, this is kind of a sticky area. And again, when we talk about over-the-counter, that's what OTC stands for, over-the-counter meds and supplements. Those are things that, again, please talk with your doctor or healthcare professional prior to changing anything in your medical regimen. These just happen to be the things that work best for me. So as far as over-the-counter therapies, aspirin has been amazingly helpful. I am that person that all through like my teenage years and when I was initially starting to manage my EDS, I was chowing down ibuprofen and naproxen like they were candy. Like I would not leave the house without naproxen in my purse, especially like during your time of the month. Like that was like I was gonna take 2 or 3 naproxen in a day on those days. Then I became a healthcare professional and I found out how bad they are for your kidneys and for your stomach. So I basically said, okay, that's not an option for me anymore. One of the things I found out recently at the EDS conference in Nashville, Dr. Ann Malin, who's an immunologist and she specializes in mast cell disorders, talked about aspirin as something that can actually help stabilize mast cells. So for people that deal with mast cell disorders, which is really, really common with EDSers, aspirin, if your stomach can tolerate it, is actually one of the best anti-inflammatories for people that deal with mast cell inflammation. Other topical therapies, or rather other antihistamines that are super helpful are things like Benadryl, things like Claritin, things like Zyrtec, and those are all available over the counter. Again, it's just kind of a trial and error, and it depends what works best for you. And I'm going to show you guys some of the topical therapies that I use that are available over the counter. So one of my favorite ones, I'll show my Instagram people first, and then the people on the webinar, the CVS Thermacare heat wraps. These are the ones that go around your neck. And Kendra, can you guys see that okay? Let me stop the share so that you can see my face there. Perfect. Can you see me bigger now?
See it. Yes, I was writing notes, but yes, I love those. And I actually made a note to share what I have found that's actually similar because there's so many different kinds.
There's so many different kinds, but honestly, like
I'm with you on the heat wraps though.
Yes.
In fact, I think I'm a little obsessed with them. I gotta be honest.
Yeah, no, 100%. I use those all the time. That's like one of my jams basically. Also over the counter, they make lidocaine patches that are 4% lidocaine patches. Thanks, babe. And David's bringing me other topicals. But they sell over the counter lidocaine patches that have like aspirin cream in them. And then another big one that I'm like obsessed with are these salon paws. Let me get a shout out or like drop an emoji basically in the comments if salon paws are like your favorite too. These
what are they?
Oh my gosh. Okay, so salon paws, the active ingredients of them are, oh my gosh, about to change your life, Miss Kendra. Like camphor, menthol, and methyl salicylate, which is like an aspirin derivative.
They're like methyl. They have like a cooling.
They are cooling.
What happens if you can't tolerate anything cooling? Like it literally makes me cold to the bone.
Then that might not be a great option.
Might not be my jam. But
That's
for
true.
other people, it might.
Other people, they could be
handle
yeah.
it. I don't. It's weird. Like anything, if you go to like pedicure, get something rubbed on you, like if they use any kind of cooling thing, literally, it makes me cold to the bone.
Yes, so maybe not for you. These might not be a good option. The benefit, though, is that they do have the salicylate in them, which is a similar derivative to aspirin, because aspirin is acetylsalicylic acid.
If you can tolerate it, because some people have allergies to that.
Some people do have allergies to these, but these just happen to be what work best for me.
So what's it called?
Really small. Salon pause, like salon, like a salon that you go to, and
salon pause.
Salon pause.
Okay.
Salon pause. And they're really small, which is nice. So like,
so I guess the big thing for any of these things, whether it's, because we're talking about all these different things and there's all these different, tips and tricks and life hacks that work for all of us, and finding what works for you is really important, but also making sure that we are really, really cognizant to not just take like what works for you, Brianna, or works for me, or somebody on Facebook, or 5 million of your friends. You could have the one thing that you react to in it. So make sure you always read the ingredients. Not only that, but you read what it's made of.
Absolutely.
You don't know what it's wrapped in or what's included in it. And packaging. So just I love life hacks. I love little tips and tricks. I love researching what people do, but just make sure that you remember that just like taking diet and that kind of stuff, also individual, that you do make you do your due diligence to like look at the fine print.
Yes.
Even within the packaging of the box. I mean, it could be something that they, are in a warehouse full of tree nuts or something. Who knows?
Totally. Exactly.
We have to all still do our due diligence, no matter if 50 other or 500 million other EDS patients do well on it. We have to do our due diligence to help ourselves.
That's a great point.
And be advocates.
Yes, 100%. And so that's one thing that Kendra brought up for those of you watching on Instagram, is that just because these work for me doesn't mean it will work for you. So please be cautious to do your due diligence to check and make sure that it's something that you can tolerate from like a sensitivity standpoint, so that you don't have cross-reactivity or further exacerbate your symptoms. And then lastly, not technically over-the-counter, but for those of us with chronic illness, sometimes we're in the hospital fairly frequently. Steal a couple of these little ice packs if you can tolerate cold. These little guys, they're the ones that are travel ice packs. You can pop them, and then it's like an on-demand cool pack. The benefit of these two, some CVSs do sell them over the counter, so that's another option.
I have to say, and I'm sure my younger son wouldn't really appreciate that I'm saying this. So my kids are outside all the time. They won't mind that. They're outside all the time.
Right.
They're outside in rain. They're outside in the dark. It gets dark at 4:30. Well, the new thing right now, because of the winter, is they've been making like bike trails, like mountain biking trails in our yard, and we have 2 acres, so it's really nice.
Cool.
But my middle son has been enjoying it. He hasn't been mountain biking as much as my older son, but he's also using a bigger bike. And if you can imagine, if you're a boy on a taller bike,
right,
he's gotten some serious bruising. I mean, like in his inner thighs, like serious bruising, like to the point I'm like, whoa, man. So those cold packs have been like super important to help put down the inflammation and the pain. But then also, we also keep telling our kids, but the heat is really important for healing after for injuries.
Totally. So any acute injury, you would want to treat it with ice first. And then once it's more chronic, then you can move into heat. You don't ever want to put any type of heat on an acute injury, because you can actually make it bleed worse.
Right, because the heat brings the blood and it like essentially the healing, what you want, to the area afterwards. So you don't necessarily want it right away.
Exactly. No, that's a great point. That's a great point. And then my over-the-counter antihistamine that I take is typically Benadryl for flare-ups. And then I use Zyrtec as my preferred antihistamine. I tried Claritin, I tried Allegra, and those don't necessarily work for me. I do have, do I have a question in Instagram? Oh no, that was a wave. Sorry.
Somebody mentioned that they also love Salon Pause, but they also make her cold to the bone. So interesting.
Yes. And then I'm interesting to hear that insight. I'm glad that they work, and it's kind of like a risk-benefit analysis, right? Like, is it worth it for me to take the Salon Pause when it's, flaring me up, basically? Go ahead.
I was going to say, just because I know you're going to continue on with your slides, and I'm going to shut my mic and my video, but would you mind, I know we're talking a lot about personal experience. We're talking about what holistic integrative, if you will, pain
Right.
management is. Can you just define that a little bit?
Sure.
You also mentioned multidisciplinary. So when people are talking about like, what is this? Like, what is this holistic pain management? Like you said, you had a good comment about what it wasn't, that it's not,
right.
eating salad and it's all going to go away.
Yeah, exactly.
So can you talk a little bit about what it is, the difference in the verbiage of like integrative, holistic,
Sure.
Multidisciplinary, and then you can continue on.
Sure thing. So with holistic, so for those of you on Instagram, like we're defining holistic therapies again. And so basically holistic means you're considering the whole person. So you're treating all sides of it rather than taking just one single approach. So rather than being like, what's the medicine that's going to help me the most? Rather than having kind of like a one track mind in that sense and saying like, oh, this is going to be the therapy that works for me. Holistic just means that we're addressing all factors from a biopsychosocial standpoint, so meaning our biology, our psychology as well, and then also external factors like our life circumstances and support. Because I've had patients before where everything is dialed in, their medications are doing great, but then something like happens, like a death in the family, for example, and that's a totally external thing, but that can throw people into a flare because those external stressors flare up our nervous system and cause additional symptoms. So considering all of the pieces that play into the existence of a person and treating as many of those as we can simultaneously. That's
seven dimensions of wellness in public health. I mean, essentially is what you're talking about.
Yes, exactly. So a multidimensional or multidisciplinary approach to pain management. The other thing that we want to consider too when we're talking about like verbiage with integrative medicine and functional medicine. With integrative medicine, those are providers that actually have board certification in that type of specialty, where they're familiar with all of these Eastern, Western modalities, with the biopsychosocial modalities, ways to incorporate all of these into your treatment plan under one roof. So that would be like an integrative medicine specialist.
And that's a newer type of fellowship, if you will.
It is.
Medicine, am I right?
Yes, it is newer. And, you know, what's really interesting is Dr. Connie DeLine, who's the head of the Spinal CSF League Foundation, she's actually board certified in integrative medicine. So she's got a super duper comprehensive approach to managing CSF leaks, for example. So making sure that if someone claims that they're an integrative medicine specialist, that they have that certification is really important, because if people are out there like, oh, like, this is, you know, I'm an integrative medicine provider. Like, well, are you board certified? Are you sure that, you know, you've had that type of training? Whereas functional medicine is basically with the principle in mind of optimizing. So optimizing care, optimizing nutrition, optimizing your medications, and really with the goal of improving your function and making kind of a directed goal.
Approach too, right? So
exactly. So they all kind of fall under that similar umbrella.
All under a similar umbrella, but it is important to understand from the medical side, from your clinical medical side, as a clinician or as a practitioner, the different verbiage and why that matters. Especially to you. Like we were talking about totally the title of this webinar. You were like, we need to make sure that it says holistic, not integrative. And I was like, well, you know, and you explained why. And that's important for people to understand.
Totally. And it's important for like people that are going to be spending money to go see these providers, because a lot of providers that do integrative med are not board certified and they are not covered by insurance. You know what I mean? So like if you're going to be spending thousands of dollars potentially out of pocket to see someone who claims they're an integrative specialist, make sure that their credentials line up with that, because that literally is its own separate fellowship. So
well, I will say, I also don't know that it is a rule now in medicine that you can say, you cannot, you know, I'm not a provider and I'm not a medical provider, but I do work with a lot of providers that are integrative or functional medical providers, and they have their own caveats. But I don't think that there's a rule in terms of like, you cannot say that you are integrative medicine for medical provider unless you have this credential. Because
there's no hard fast rule.
Yeah, it could be that they are explaining the way that they practice. And
exactly.
They incorporate into their practice or not. So I just want to be careful about that too, because there is no hard fast rule that I'm aware of yet, because this is newer, that a provider that is integrative needs to have this.
That's true. So people can practice an integrative approach.
Right. That's the way that they look at it, is an integrative approach. And, you know, to me, it's very open.
Yes. And I think the reason I bring that up more is like for a consumer protection kind of thing, like so that people know like that there is truly a specialty in that.
Well, and a lot of our providers, all truth be told, also don't take insurance, as you know. I mean, you're well of it too. I mean, that there are providers that don't take insurance for many reasons because they found that they can practice better. So I'm not going to say either way. So that isn't, I just want to make sure that we're clear that that's not a judgment either way, that those.
Oh yeah, there's no judgment in any fashion. Just before people go and spend that type of money, like just do your research on the provider that you're going to see. So like I used to see patients in like a insurance-based scenario and I could only see them for like 15 minutes and I couldn't recommend a lot of integrative therapies because they wouldn't be covered by insurance. But now I see patients by appointment with a different doctor and we don't take insurance and I'm able to do like 4-hour consults with people. So it's really, really, really a night and day difference in the level of care that I can provide. So definitely like, absolutely, I have no judgment towards people that don't take insurance.
It could be just a matter of verbiage, but I do agree that, when we're going out to see providers that, recommendation and reputation, understanding where the provider's coming from, term of practice and what they're doing is really important.
Totally. No, couldn't agree more. So,
all right. So go ahead.
I'm going to bring my slides up one more time. All right. Can you see my slides? Perfect. All right. So moving on. So the next topic that we're going to talk about is kind of still a hot button issue, but it's the topic of cannabis. And cannabis encompasses CBD, THC, and all of the other terpenes. Cannabis encompasses hemp and marijuana. Sorry, my doggy is crying right here. And depending on your state, you'll have access or varied access to either one of these. So CBD or cannabidiol is considered a hemp-based product that falls under the cannabis umbrella. And CBD products are available in all 50 states. CBD is legal per the Farm Bill as of 2018, and it's available in any state. And a lot of times things are available over the counter. So one of the things as far as CBD that I incorporate in my wellness regimen, again, this is not a recommendation, just sharing with you all what helps me. There's various CBD products. So this is one that I literally bought at Sprouts. And the reason I purchased it is because there's no chemical additives to it. So it's Epsom salts, Himalaya salts, and this also happens to be the lavender one, but they made a totally unscented version of it. And this is a CBD bath soak. So it was available literally at Sprouts that I purchased it. And it's actually really, really helpful for me to soothe my muscles. One thing from a CBD and THC standpoint is to know that CBD typically does not help with sleep because it does have a mild stimulating effect to it. So if you're going to buy a CBD oil, make sure that you're following various safety protocols, like making sure it's lab tested, making sure that you're not like buying it at a random smoke shop or something like that. So making sure that your CBD is lab tested, making sure that the CBD oil comes from a CO2 extraction, not like some type of solvent like butane, because then you're basically like inhaling or ingesting other various forms of butane. And then also knowing that CBD does not produce any type of like psychoactive high is really important. So that's kind of the distinction, because when you move into things like THC, which is the marijuana part of the cannabis umbrella, when you move into things like THC that can produce a psychoactive effect, but in low doses or in topical administrations, that's typically not the case. So one of the things I do is cannabis consults for people. I do those online. And I don't ever make product recommendations. I don't give people like medical recommendation cards, but I kind of steer people towards like, what might be a product that would put me in the ballpark and of, the relief that I'm trying to seek. And one kind of word of caution with any type of cannabis, whether it's hemp or marijuana, CBD or THC, the issue is that there's zero regulation in any of the country on any of these. So when you're trying to look for a product, keep in mind that the person that's discussing with these perceived benefits of these products are probably getting some type of financial incentive from one of these companies. So be very wary about like the products that you choose to use, because the information that you might be getting may have some type of commercial bias for it. So just really consumer protection as a huge part of the awareness there.
And just my also caveat that I think is really important, because I know that this is such a hot topic and I'm comfortable talking about it. I don't have a lot of personal experience at all. And I wouldn't, I'm very clear to share mine, but even you and I have talked about the differences in the states between like Maryland and in California. Like in Maryland,
Right.
it is, legalized, but from a medical perspective, you have to go to a provider that has gone through and become a cannabis certified provider and
right.
get and like the MMCC card or something like that. So in California, it's different.
In California, it's completely legal. Like
Right.
as you're 18 or older, you can literally walk into a shop and be like, 1 marijuana, please. Like
Right. So here it's different, especially when it comes to medical stuff. People have to have a medical card. They have to go to a provider that is, and correct me if I'm wrong, because like I said, I don't have a lot of experience with it. And I don't know, and I don't have one. So, but I know the providers that have had to go through further training, and then, you have to go to a provider that, you have to, I think,
Right.
online in the state of Maryland to get a card.
You have
to go to a provider that actually has been through the training. And then even when you do that, then you have your card and you've gone to the provider. Like from what I also understand is that, and maybe you can touch on this a little bit, is that we've talked a lot about medical metabolism and metabolism or pharmacogenetics, and how that could be an issue in terms of different therapies, medication, supplements, different things. But this also could be an issue for cannabis. And maybe we're talking about orally. I don't know that it necessarily makes a difference for topically, but I know that that's, sometimes where the providers that I have heard about also that can play a role. And I've even seen some research and some articles written about this too. So I think what you said about why it's so important to really be just conscious of where the information is coming from and to be aware of the different strains and different types and different things is really important.
Yeah, no, I couldn't agree more with you there. Can you hear me? Sorry, my headphones cut out.
Yeah.
Okay, perfect. No, I couldn't be in more agreement with that. Like, please do your due diligence before utilizing a cannabis product. Full disclosure, like cannabis products can be super duper expensive. Like the first time I walked into a dispensary, I ended up spending like over $200 for like a few products. And those are not any of the products that I continue to use like in my daily regimen. So for me, I don't use any type of like inhalable or smokable type of cannabis unless I have in just severe 10 out of 10 pain, but that's not like my daily driver, so to speak, from a cannabis perspective. So a couple of the different brands that are things that I use, I really prefer topicals if I am going to use any type of THC. So the brand that I have here, and again, all of the brands that I use don't use chemical additives. They are third-party, independently lab tested, and they come from licensed dispensaries, meaning that they actually have business licenses to be able to sell their cannabis products in the state of California. So this brand is called Papa and Barkley. And this is a 3-to-1 THC to CBD relief balm. And I'll show it here for Instagram people. And basically this Papa and Barkley brand, it doesn't have any scent or additive to it. It doesn't have any of like the mentholated stuff that some people might react to. It's lab tested, and it's really, really helpful for kind of just acute aches and pains. And it's helpful for sore muscles. The other bath soak that I like to use is by a company called Kush Queen. And it's this guy right here. It comes with different scents, but they don't use chemical additives to it. They don't add chemical additives to it. This one is 25 milligrams of THC and 22 milligrams of CBD. And this one does not produce a psychoactive effect for me because it's a topical. It's a bath bomb. Other things that can be available for those of you that live in a non-legal cannabis state, the company called, what is it called? I forgot. Let's see. Life Elements. I had to look it up. Sorry. The company called Life Elements, they make a CBD all over body stick. This one's actually safe for pets as well. So basically it can be used like as a chapstick, it can be used as a muscle roll-on, and it's full spectrum, CBD only, third-party lab tested, and there is no fragrance and no chemical additives either. They do make bath bombs, and they ship to 50 states. So that's another great option. Another company that I handed out samples actually at one of the EDS local meetups in Southern California is by a company called Sue Bean. and that's SOOTHEENE, and that one has emu oil in it, so it seems to penetrate really deeply, and that's what I used after I had back surgery, and it was super duper helpful for me. And then for those of you who want to, I guess, use more than just a topical, so like an ingestible form of cannabis, edibles that are in very low doses can be helpful for people because they have a long-lasting effect to them that is systemic, meaning that it goes through your whole body versus just like being applied to a specific area. So this brand is called Kikoko, and it's actually various tea satchels. So it comes in like this cute little box, and basically there's various types and various concentrations of the THC to CBD. So they come in different ratios. One is only CBD with no THC. One is higher THC than CBD, and there's various different types. So again, that's called Kikoko, and that's a tea. And then as far as other types of edibles, this brand is called Camino, and basically it is a super low dose. It's actually the lowest dose I've been able to find in an edible, which is 2 milligrams of THC. So it's a super low dose edible, and that happens to be the kind that I can tolerate following like a back procedure or some type of like medical procedure that causes pain, where I anticipate, hey, I'm going to be in pain for like several hours. That's a better option than a bath soak at those times for me, at least. So.
I just wanted to say again, to just make sure that everybody understands that you are sharing your personal,
my personal
experience and what you personally do, that this is not necessarily anything at all that EDS Wellness is recommending or saying, or that you are recommending as the patients. This is just you're sharing your personal experience.
Yes.
And your personal, how you vet things and just different things. So you are sharing your experience. There's nothing that EDS Wellness is stating or backing that you are stating or backing or recommending for patients either. That if you really are very, very curious, I would highly recommend that either you submit a question to Brianna privately or that you talk to your provider about it.
Perfect. So thank you, Kendra.
That I said that.
Yes, and for the people watching on Instagram,
I know this information is very, very helpful. This is stuff that people want, but we have to make sure that we are we do our due diligence as professionals to make sure that people understand this is your experience, this is your personal experience.
Correct.
This is not something that we are recommending that EDS Wellness is stating or backing, and that we're recommending as products. This is just you. This is not necessarily what you even are recommending for patients. This is just your experience.
Right. And so for people on Instagram, none of these are product recommendations, simply sharing what works for me. So this is not something that is backed by myself or Kendra at EDS Wellness. Disclaimer. All right. So I'll go ahead and move on from cannabis. And if people have like specific cannabis questions, they can sign up for cannabis consults on my website where I can do like more personalized suggestions. But again, those aren't recommendations because legally PAs can't even recommend officially cannabis. So it's more of an educational information session. So, alrighty.
All right, go ahead.
Yes, chiropractic. I know this one's a hot button issue.
This is another hot one.
Hot button issue. I know. And it's like, so chiropractic care in general is not great for EDSers. I have gone through a couple different chiropractors, some that I felt like made things way worse. Some that I felt were like, oh my gosh, amazing, and it really helped me. With chiropractic, please, please, please be very cautious of the provider that you select. Ask in advance, like, hey, do you have experience working with people with hypermobility? Do you have experience working with EDS? What are your approaches to chiropractic care? So one of the things that I found out is that there's multiple different types of chiropractic care. And the type that is the gentlest and doesn't actually do any like manipulations, right? Like those crunches where like you're going to dissect an artery or something. Some of the most gentle approaches that can be taken are by people called sacral occipital therapists. And that's a very particular kind of chiropractic that doesn't involve any type of forceful manipulation. So for me, that's been the one that I've found to actually be safe for my EDS neck because I do have craniocervical instability. So I am super duper picky about like anybody touching my neck or attempting to do any adjustments. And I think of sacral occipital therapy as basically kind of guiding everything back into place. They usually start from like the SI joints and then correct the SI joint and the craniocervical junction gently without doing cracks or manipulations, and then kind of facilitate the alignment of the rest of the spine. And they can also do gentle joint mobilizations for other joints. So I definitely find that that's been the most helpful chiropractic for me. But again, please, 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 if you are planning to pursue chiropractic, ask about their experience with hypermobility or EDS specifically, if that's what you have, and just be very cautious before letting somebody adjust your body. So
I'm glad that you brought up the different types or focuses of chiropractic too, because I feel the same way as you. I know that we all have to be cautious. It's a hot button, but I found significant relief personally from different providers, but they use a different approach. Some of them also do this kind of neuromuscular kind of like proprioception type of work.
Yes, like proprioception.
Totally the name and the focus, and I apologize, but
it's okay.
I think I couldn't even list all the different types, but
yeah, I have
even
no idea. There's a bunch.
That we're totally butchering it, but I think it's very important because I think most people don't really understand that there are different branches, focuses, different ways of practicing chiropractic and different modalities that aren't the traditional way. And that you said, making sure that you do your due diligence to ask the provider, to ask their experience with us, specifically the different types of EDS too, because, not just hypermobility, but, there's other conditions that, have more vascular risk.
Totally, like vascular components, or people that have like vascular EDS, or that have aneurysms or anything like that. Like
vascular conditions that are other connective tissue disorders that have more vascular risk. So it's always important for us as patients to do our due diligence, but then to also learn a little bit more about these different areas of focus. If they say, no, I do this kind of practice, to do some research. People are adding some.
Yes, we've got some chiropractic questions. All right.
So do you want to add? We'll go to the questions afterwards. So keep going.
Okay, perfect. Yeah. So chiropractic in a nutshell, do your homework. Ask about, their familiarity with your type or your specific condition. So just the same way that we wouldn't say that like all pain management docs are the same or all different types of healthcare providers are the same. Not all chiropractors are created equal. I straight up had a chiropractor, the very first chiropractor that I went to, told me that the reason that I was having shoulder pain and dislocations is because there was a emotional trauma that my great grandmother had experienced when she was my age, and like her spirit basically was like manifesting in my body, and that's why I had pain. And I was like, thank you very much, I'm leaving now. Like, so that was like the first chiropractic experience that I had, and I like straight up just walked out of the office. So not all chiropractors are created equal. They don't all practice the same way, so find one that works for you. Let's see, next slide is acupuncture. Kind of another grab bag with finding a good provider that works for you. So not every acupuncturist is created equal. There's traditional Chinese acupuncture, and then there's like modern or like Western acupuncture, all various types, and it goes based on meridians, which are like the various like energy lines through your body. I am fairly ignorant to this topic, so I'm not going to pretend like I know like what the meridians are or how the specific acupuncture types help with that from like a physiologic basis, but it's been around for thousands of years. It's helped a lot of people. Believe it or not, some hospitals offer acupuncture as like an inpatient service. So both my husband and I, when we've stayed at Cedars-Sinai, we actually request acupuncture as part of the pain management protocol that we do. And an acupuncturist literally comes to the room and does acupuncture like in your hospital bed. So acupuncture may be a helpful thing for some people. It just happens to be a helpful therapy for me, but it's not a frequent therapy that I do because the only good acupuncturist that I know of is in Hollywood, and that's like 2 hours away from me if there's traffic. So that's just kind of like an intermittent thing that I've done in the past that seems to be helpful for some of my like musculoskeletal aches and pains. Babe, you didn't have as great of relief from acupuncture, right? So my husband is like vigorously shaking his head like acupuncture did not help him. So again, it's not for everybody. It works for some people, but not for everybody. All right, moving on next to craniosacral therapy. Craniosacral therapy is something that is done with either doctors of osteopathy or physical therapists or other practitioners who are certified, like medical certified practitioners that can go get additional training in this modality called Craniosacral Therapy. And Craniosacral Therapy basically works to establish like the energy and normalize the flow from the cranium to the sacrum. And I consider this like if Reiki could have like a super duper advanced version of like energy work, basically. So the craniosacral therapist that I go to is in Redlands at Outback Physical Therapy. Her name is Kristen. She's amazing. And she's honestly helped me kind of with the brain fog that I experienced after having my brain injury from the CSF leak. Craniosacral therapists can be incredibly helpful to facilitate healing for various parts of the body, and are very intuitive and can have a lot of insight into things that might be going on. So I feel like they can really feel your body if they're a skilled craniosacral therapist. But again, it's a grab bag. So my husband and I both benefit quite a bit from craniosacral therapy. One of my good friends just went to a new craniosacral therapist out in Pasadena, and they told her that the spirits in the room were telling her as the practitioner that it was okay for my friends to like release the negative energy and tell her cells that she could heal. And my friend was like, yeah, I'm not really comfortable with that, because you're basically saying that like I can think people could like think away cancer, or like I can think away my EDS. And this person straight up was like, yeah, you can think away your cancer. And she was like, oh no, like not for me. So kind of in the same boat as like chiropractic, acupuncture, like craniosacral therapists are not all the same. For
right. You
me,
gotta find the person that works for you. I will also
Yes.
tell everybody that we have a great webinar from the 2018 webinar series on craniosacral therapy. So I can provide the link to that. And also one of the webinars that we've done 2 webinars ago, and I haven't edited it yet, and I haven't posted the edited version, was on acupuncture and energy medicine.
Wonderful.
And anyway, I won't go into what all that entailed, but it was great. It was actually with 2 medical providers, 2 traditionally trained allopathic medical providers trained on acupuncture, and then one of them went to energy medicine. So both webinars, one of them I already have the link and I can provide, is on craniosacral therapy. Is great. And then the other one, the edited webinar on acupuncture and energy medicine share. And sometimes a lot of these fall into a bigger umbrella. So if you're curious and you want some more science and research behind it, and to understand what's there and what's not, so 2 great webinars that I'm happy to share links to.
Wonderful. Thank you, Kendra. I'm so grateful for like all of the different perspectives on medicine that you bring in, because from that holistic standpoint, like it really is a trial and error, and finding what works best for you is really the most important thing. So I'm super grateful for all of the information that you provide to our community, because it's super helpful. So let's see. All right. So the next one, physical therapy, Pilates, pool therapy. Again, please, 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 if this is something that you plan to do, consult your healthcare provider. Be very careful of your body and its limits. Make sure that the practitioner that you're going to is familiar with EDS. So physical therapy, for me, the first physical therapist I went to made me worse because I had an unstable SI joint, and they were trying to rehab my knee. And then they basically were like, oh, like you're just kind of lazy for like not progressing through your therapy. And it turned out that my SI joint was out of place. And that's why I couldn't do a lot of the therapy. So please make sure that if you go to a physical therapist, that they are familiar with EDS, that they're familiar with your type of condition, and that they listen to you. And with any of these modalities, listening to your body and providing feedback to the practitioner is really, really important. So if you're doing physical therapy and something is hurting, tell the physical therapist, because sometimes pain is expected and other times it should not be there. So please make sure to get feedback. Also make sure that the physical therapist has experience with EDS. I know Kevin Muldowney is on your side of the country and sees people with EDS, I think, exclusively. Costa Colina on our side of the country, which is in Pomona, California, has an EDS physical therapy clinic where all of them are actually trained in the Muldowney protocol. They start with pool therapy when needed, and they basically progress specifically with EDS patients. So it's definitely
and we've also done webinars on Pilates, and I also have done a wonderful webinar with Adam, the fibro guy from the UK.
Oh, great.
I absolutely love, and he focuses just on, forgive me, Adam, totally butchering it. Like there's no label, you know, he's not a huge label person. And I personally just really identify a lot with him as an instructor. You know, I do teach yoga and restorative exercise, if you want to label it, but I do like his approach a lot when it terms of just movement is movement and however you think. So what matters is the provider, like you said, and doing your due diligence to figure out who works best for you, and however you get moving is great, you know, and
yes,
these things are just one part of the bigger movement puzzle that we really need to do.
Exactly.
And sometimes what we can do is just 5 minutes, like I always say. And if you can just do just 5 minutes before you get to physical therapy or Pilates or the pool, because that's all you can do, that's great. You know,
yeah, 5 minutes somewhere. Is better than 0 minutes.
Yeah, 5 minutes. Sometimes it's just a matter of, you know, changing the position that you brush your teeth in. You know, little movements matter. It doesn't have to be these big things if you can't get there. So starting somewhere is great, but then I like what you said about the approaches to these. Once we are ready, or maybe these are the way that we start. That's how we get going. It just really depends on how you get going.
Totally. Yeah, no, I think you're so right in that. And that was something that when I had my CSF leak, I was like, I still have a CSF leak, but when I was like much more symptomatic, like I was profoundly deconditioned. Like I couldn't even get up out of bed half the time. Like I literally needed my husband's help to like sit up from laying down. You know what I mean? So like whatever your level of conditioning is, there's always a way back. So I think like the take home from that is like there is some type of movement that will help almost everybody. I think really the only condition that there's an exception to that is like ME/CFS, like chronic fatigue syndrome. I think that's the only one where like you must be medically supervised and like no amount of exercise is going to help that. And in some cases it can make things worse. So just being super duper cautious, being aware of what you've got going on. And if you've got something that's like actively hindering you from doing physical therapy, like a medical condition that is undiagnosed or POTS or something to that effect, like please, please, please make sure you consult with a healthcare professional before doing any type of physical therapy or pool therapy or Pilates, restorative exercise. But as my physical therapist says, she says, motion is lotion. And that helps me to kind of, even any little bit that I do, feel like it's a worthwhile endeavor to drag myself to the pool or to, you know, get on the elliptical or whatever it is that you do. All right. And we've got some pain relief tools now. I'm going to go ahead and...
Can I interrupt you for a hot second? And I don't
totally
want to do more because I know that we've been taking time. We're going back and forth. But there's been a lot of supplement questions. So I just want to make sure that people understand we are going to get to supplements. So
yes, supplements are next after pain relief tools.
Good. So keep going. I love pain relief too.
Yes. So supplements pain relief tools that I've got. The link on my website, healedandempowered.com. There's a shop on there. But
love
various
the
things.
TRX. I just did that the other night.
Yeah, I'm not advanced enough. Oh, hi, Athena. My dog is like here. There's various pain relief tools. Oops, sorry. She like clicked my PowerPoint for me. All right. Stop share. Boop. All right. So pain relief tools. This is called a back knobber.
Back buddy. The back
yes.
buddy. I have it.
There's a back buddy too.
It.
Yeah. And basically you put it over your shoulder and rub out your knots. This one is one of my faves. My probably next favorite is this guy. It's a cervical traction pillow. And it's literally a pillow that you inflate. Hi, Athena. Doggy came in here. You put it around your neck and you attach it. And it literally comes with like a little inflatable ball. And you pump it up. And it gives you cervical traction while you're upright. So you can like have traction while you're cooking or, you know, doing stuff around the house or whatever. So huge fan of that. Let's see. Various braces that I use. So braces are super helpful. Another thing that I've found recently for my husband who has really severe TMJ is this little thing, and it literally goes around your head like this and holds your jaw in place for TMJ. And on the inside, it has removable / reusable ice packs. So for people that can tolerate ice, you can also microwave them if you prefer heat. And basically, it's the ice pack. So
we have those for my kids. So you can wrap them around a wrist or an arm or a leg. They have them too. I was going to share this. Do you have one of these?
I don't. What is that?
Oh my gosh. So my family, well, I have a lot of the stuff that you have too. And I just want to say that I'm happy to share. When I did the Just 5 Minutes classes, I would share all these tools and tricks too, and all the links. So we are huge fans of these like shiatsu pillows.
Ooh,
they have
nice.
different like sizes and different, hardnesses and different things. But this is one of the first ones I ever had that I like literally, Brian said I like rubbed it raw because I would like press on it.
Yeah. Yeah.
Some of them have heat or not, but like you have come down really less expensive. You can also buy TENS units on Amazon. Like we have a ton of like, anybody that ever comes to my house, Liz, who I mentioned before, knows I have pretty much anything that anybody ever wants to try, and I'm always happy to like lend them out.
Wonderful.
Yes. So there's various different types of pillows too.
Excellent. All right, so I'll move on to supplements. My slide for it, I think, was back with the over-the-counter ones, but I'm going to move into supplements. If people want like additional pain relief tools, like literally the link is on my website, and there's a whole shop with various ones that I recommend. But those are just some of my like favorite ones that I just shared. So moving on to supplements, and again, supplements, like please know that these are the supplements that my husband and I use. I'm not recommending these for anybody to treat or cure any type of medical condition. These just happen to be the supplements that work for me. And it was a very long process to get here in order to find out like which supplements worked for me and worked for my husband. So there is some variability, but basically with various supplements, please make sure that there's no interactions with medications that you're taking, and that there's no additives to the supplement that could potentially hinder or make things worse for your body. So there was like a calcium supplement that I was taking for a while, and I was like, gosh, like I really feel like my brain fog is coming back. I don't feel good. And then my husband looked at the ingredients and he was like, oh shoot, babe, there was potato starch in here. My bad. Like, so sorry. And I was like, oh shoot, like that makes sense. But I'm glad that it was the potato starch, which is the nightshade, and not like that I was getting foggy again, right? So whatever works for you. So the first one I'm going to start with is MSM, which stands for, let's see if I can pronounce it, methylsulfonylmethane. And MSM is something that has been clinically studied and can be helpful to support joint pain, and also is helpful for antioxidant support. The dose of this that I take is 1,000 milligrams, and I take 3 capsules of this per day. The brand that I use is Doctor's Best, and again, it's MSM. I really like the Doctor's Best brand because it has high bioavailability with a lot of the supplements. The next substance is called ubiquinol plus PQQ. So ubiquinol is this QH negative formulation, and ubiquinol is basically the more bioavailable version of CoQ10, which is a vitamin that's really, really important for your mitochondrial function, as well as important for the heart muscle utilization. So it's helpful for your heart. But the PQQ, which stands for pyroquinoline quinone disodium, basically is helpful for connective tissue and can be helpful again for mitochondrial support. So this really seems to help with my brain fog, helps with my energy, helps with fatigue, and that's the purpose of why I use that one. And that one is by Jaro Pharmaceuticals. Let me hold that up, Jaro. And again, it's ubiquinol, the QH minus, plus PQQ. And that one is 100 milligrams of the ubiquinol and 10 milligrams of PQQ. I use that one twice a day. All right, the next one that I take is psyllium husks, which is fiber. And fiber is super duper important for our EDS digestive tracts, because essentially if you get constipated or if you have really loose stools, it can be super irritating to the lining of your GI tract. Also, fiber in psyllium husk form can lower your lipids. So people with high cholesterol, it can be helpful for them as well. But it also, sorry to be graphic, basically makes for an easier movement when you're having a bowel movement, so that you're not having to strain. And basically the medical, the medical designation for psyllium husk fiber is a bulk forming laxative. So it does have a slight laxative effect, but simply because it's bulking your stools and having it stick together, so it's just one smooth passage. Sorry for the being graphic there. But essentially, it doesn't have a stimulant effect on the bowel, so it's not going to cause cramping or anything like that for most people. I use this brand called Yerba Prima for the fact that it comes in a veggie cap that doesn't have any type of like additive to it. So some veg caps or some capsules or additives to vitamins can be things like soy or gluten or wheat. Some have dairy in them for whatever reason, like they use like some type of like milk as a thickening agent, which is so bizarre to me. But there's all types of different additives that can be in various supplements. So please, please, please make sure you check the ingredients of any supplement you purchase. The aspirin, we already talked about. I use an 81 milligram just over the counter CVS value size aspirin. And then I use the one that has the enteric coating or the safety coating. Unfortunately, hi Athena. Unfortunately, it does have yellow number 5 in it, which I'm not a fan of having that additive, but I have not been able to find a dye-free enteric coated aspirin. And again, the enteric coating is to basically keep your stomach lining intact as much as possible and make it less irritating on your GI system. Let's see. The next thing that I take is Boswellia. This brand is by Solaray, so it looks like this. I recently did an Instagram post on this. There it is. Boswellia is actually clinically studied to have benefits for anti-inflammatory. Someone asked if I take aspirin daily, and yes, I take 2 baby aspirins in the morning and 2 baby aspirins at night. And also I do have what's called a coagulopathy, where my blood clots really fast. So I use that as just like a daily maintenance thing. But back to the Boswellia, the brand is Solaray. And I like this one because for the price, it has the highest concentration and it doesn't have any additives like wheat or any other type of like chemical or color agent to it. And Boswellia is used for headaches. It was also recommended by the neurologist that we saw recently, who he was like a huge proponent for Boswellia helping with headaches. And with CSF leaks, headaches are like the main symptom that I deal with usually. So that's something that's super duper helpful for my headaches and also seems to help my husband's headaches as well. Let's see. The next one is more of like a superfood support that I take because it can help with mood regulation and help with the microbiome. This one is by the brand Host Defense. And it's a mushroom complex, and it's specifically the one called Brain. So I'll hold it up. Myco Botanicals Host Defense. And it's basically a mushroom complex. And this mushroom complex has lion's mane mushroom, which can be helpful for cognition. It also contains reishi mushrooms and another herb called gotu kola, all of which have been basically studied for their effects with mood regulation and cognition. So basically to help support memory and reduce brain fog. That's why I take it. And this brain blend also has ginkgo biloba in it. So it's basically like a combo medication. And I find that super helpful for my brain fog, and it helps support my mental clarity. I take 2 capsules of that, 1 in the morning, 1 at night. So 2 capsules a day. All right, the next one, I know this is a lot of supplements. The next supplement that I take is calcium, and I use this Alive calcium because it's plant-based. So some, for people that are vegan, for example, are like animal-based. I like this plant-based formula. It also does have some dietary fiber, and it has vitamin D as well in it. So for calcium to absorb appropriately, you do need to have vitamin D as well. So if you have vitamin D in your multivitamin, then you don't need it in the actual calcium supplement, but a lot of calcium supplements will contain vitamin D as well. Here's Athena. Hi, Athena. I do the serving size of this is 4 tablets today, so I do 2 in the morning and 2 at night. So let's see. The next one that I take is a multivitamin. And so this one is, I would say, the one that I searched high and low for, and for the longest time was super duper unsatisfied with the multivitamin. So this is a women's one a day by Mega Foods. And the reason I like this company or this particular brand of multivitamin is because the B vitamins are methylated, which means that for people with the MTHFR or MTHFR gene mutation who can't process unmethylated B vitamins. This is one of the few that contains basically the B6 vitamin or the folate, not from folic acid. It's like a broccoli plant form. So it's a higher quality B vitamin, and it doesn't have any additives to it. So that multivitamin, it took me like years to find one that fit all the requirements that I need. And again, that brand was Mega Food, and it's a women's one a day. Let's see. The next one that I take, and for people that are like, oh my gosh, this is like a ton of vitamins, like what are like the top ones that you would pick? Definitely, it's hard to choose which ones to be on the top, but magnesium certainly is way up there. So this is Doctor's Best high absorption magnesium, and it's chelated. So see where it says 100% chelated. That basically means that it's not going to just like pass right through you. It's already bound to itself. So that way it doesn't bind to the acids in your stomach, doesn't bind to the other foods that you're eating, and you absorb it much better. So basically you'll have the highest bioavailability, and other forms of magnesium like magnesium oxide won't help you for like muscle cramps or soothing muscle soreness so much as they'll just be like a laxative. So basically a chelated magnesium is super helpful for muscle cramps and spasms. It can help with muscle pain. And a lot of people that have EDS and also who have CSF leaks are magnesium depleted. So it helps as both a dietary supplement as well as with muscle cramps and muscle aches. So that's like one of the must-haves for me. Because I feel like I need more B vitamins. This is a chewable B vitamin, and it has methylated B vitamins. So you can see it says methylfolate and methyl B12. So easier to process. And for people that have the MTHFR gene mutation, I'm not sure if I'm saying that correctly. It's like MTHFR and FTHR. But for people that have that gene mutation and can't handle unmethylated B vitamins, that would be a safe option. And then another one that would be like way up, like top 3 vitamins that I would recommend, like if you just need something to help with inflammation. Oh, someone asked what brand of B12 that was. This is Jarrow Pharmaceuticals. So I really like this brand because their lab purity standards are very high. And I've got like, I think 2 more.
Well, I just want to caution also is because I'm always here to caution. It's amazing how different everybody is. And like
yes,
supplements look totally separate from like completely opposite from what I take. And it's also interesting because we have had a lot of nutritional webinars recently, and like what Dr. Christy Williamson was talking about was just rocked everybody's world in terms of like MTHFR and everything. But I will say the B12, I had to be really careful of because for it totally, you can actually, it spikes my hypothyroidism into hyper.
Interesting.
Yeah, so when you take too much, and I'll look at it, there's actually a scientific, like if you look it up, too much B12, I believe, can actually make you hyper. So for those that have
that's totally
possible.
possible.
That might be getting it from somewhere else. So basically what I was doing is I was getting it from somewhere, and then I was taking the chewable B12, almost the same one.
Right.
And basically I put myself in a hyper state. So
oh my goodness.
one of the things that we mentioned in one of the previous webinars, specifically Dr. Christy Williamson, is that we just got to be careful.
Yes,
what we do. And like you mentioned, cautioning like what is in the labels and reading them, that you have to remember that just taking these supplements, we cognizant of what they're doing in our bodies, and our bodies actually have a normal homeostasis that they try to like achieve, and too much can cause it to really go array and we don't understand it necessarily what it's really doing. We think we're taking one thing and it could be like causing something else to go awry.
Or there could be like interactions
and that that example of what happened with my thyroid issue, because a lot of us have things like that, is really important, as is, like you mentioned, aspirin. We talk about aspirin a lot.
Mm-hmm.
I can't take aspirin and I can't take Tylenol. I tend to have more vascular issues, and if I take aspirin or if I take Tylenol, it causes small vein ruptures. I literally get
my gosh,
these huge bruises that are bruises, and they've got these like white nodules in the middle, and if you press them, they look like you can literally see the blood like seeping.
Oh my goodness.
It doesn't happen as much as with ibuprofen. But it just goes to show that we're all so different. So while as aspirin's a great mast cell stabilizer, I can't take it. I mean, it literally causes these, whatever they're called, these small vein ruptures. And I sometimes
it's called petechiae.
yeah, I can still get really small ones if I take too much ibuprofen, but for the most part, ibuprofen is my savior during certain times of the month, and it does block prostaglandins. So we are all so different, and
we really are.
yeah. So I know people had specific questions about certain supplements that you did not mention. Did you finish?
I've got actually two more. Yeah.
Okay.
So last two supplements. And I saved like the best for last from like, as far as research goes, these are probably the most extensively studied. So one is omega-3 vitamins.
I take that one.
Yeah, I love this one. So it's a high dose for the price. If you're going to buy an omega-3, it's an anti-inflammatory. Actually, it's clinically studied to be as effective as ibuprofen for inflammation. It does have a mild blood thinning effect for some people. So be really cautious of this, like leading up into like surgery or a procedure, for example. And then the brand of this one is Nordic Naturals. And really important when you're purchasing an omega-3 supplement, you want to make sure that it's high in the EPA form of omega-3. So if you look at the back of, I don't know if you can see it, it's EPA, DHA, and ALA. And you want to be really careful with what you're taking, because DHA is really helpful if you're a fetus. But most people watching this webinar, I imagine, don't identify as a fetus. So it's really helpful for fetus development. And it's shown to be helpful for like developing brains for like children and like gestating babies, basically. But that's not going to be helpful for inflammation. So if you're taking omega-3s for the purpose of inflammation, the EPA or eicosapentaenoic acid is the most important element of the omega-3 to take. And then lastly, vitamin C. So vitamin C, actually, one other supplement that I have before I'll get to vitamin C, because I've got like a kind of like research to share with vitamin C. This is an oral hydrator that I take. It's called Banana Bag. I posted a link about it on my Instagram recently, and I love Banana Bag because it does have methylated B vitamins as well. And this one seems to be the most effective hydrator that I've used for when I get like POTS episodes and stuff. So big fan of that. And then lastly, vitamin C. So this is the Solaray brand. What's really important with the vitamin C is that it's the liposomal vitamin C, which means that it binds to your fat cells. So with liposomal C, it's much more bioavailable, second only to IV vitamins or IV vitamin C. And the reason that vitamin C is super helpful is because it's a really important cofactor, meaning like it's an important, necessary step basically in cellular processes. And there is some research to support that the absence of vitamin C essentially can impair connective tissue function. So taking high dose vitamin C, like 1,000 milligrams plus per day, that's the amount that's in like an emergency, for example. But taking high dose vitamin C has been super duper helpful for me, like probably one of the most helpful vitamins that I've added, because it seems like my tissue laxity is not as severe, seems to help with my energy level overall, and it seems to help with my brain fog. So definitely the vitamin C is one of those that's way up there on my list of, important vitamins that are in my daily regimen. So that is it for my supplements. And then the last slide that I had said support. So in this whole journey, as we're talking about all these things that can be used, I know it probably seems super overwhelming because there's so many different things that we talked about. What works for me might not work for everybody else out there. And essentially, having all of this information thrown at you can seem really overwhelming. So getting support, I would say, is from a holistic standpoint, that social standpoint, whether it's online, in person, especially if you don't have like a supportive spouse. Like I have the amazing fortune to have just like my best friend and soulmate as my husband, who also is hypermobile and totally like understands what life is like with a connective tissue disease and with chronic pain. He also, am I okay to talk about your health on the internet? Okay. Believe it or not, my husband was actually diagnosed with CSF leaks like last month. So yeah, I know, isn't that crazy? So we were able to identify it, and he, like, you know, if anyone can understand, it's him, because he literally goes through it as well. So these are the regimens that have been helpful for us, helpful for, you know, me, and are basically my best effort at giving us a better quality of life, with, you know, some research to back it, and with the experience to find that it's helpful. So thank you for having me to share all of this with you and your audience and everybody on the webinar for watching. You know, so hopefully this was informative information. Again, not a recommendation for you to change your regimen. Please talk with your healthcare provider. These are just things that happen to work for me. So.
Yeah, I think that's awesome. And I appreciate that, you know, caveat and disclaimer, as we've said several times, because we are sharing your personal experience. I share mine all the time, and we always say that you don't ever want to change anything or add anything without the directive of your provider. So some people, with that, we're going to go to the Q&A. That's cool.
Perfect.
So, and like I said, it's amazing to me how different, like what people take and what works for people. It's just so different even from what I do. It's just kind of crazy. And I also find it frustrating as a patient, and also as somebody that works in the field, how different the research is on these. So I can understand how everybody's a little frustrated. So somebody mentioned, can you talk about quercetin? You don't mention quercetin, or PEA was something that Dr. Dempsey, we discussed recently in a call with Dr. Dempsey. NAC, I think I take one of something like that. And then also, well, you mentioned vitamin A. So quercetin and PEA, somebody asked about that. If you want to talk about that.
Yeah, so PEA, I'm not familiar with. PQQ is something that I use to help with like mitochondrial function and energy metabolism. Hang on, I'm going to switch to like my lay down desk so I can lay down. Sorry. Can you still hear me?
Yeah.
See me? Perfect. Thanks for bearing with me as I switch to laying down mode. There we go. Can you see me?
Yeah.
Perfect. All right, great. So PQQ helps support neurologic and
mitochondrial function. Can you share your lay down desk too?
Yes, it's called
All right, talk about the supplements. Like,
on
Amazon. About the laying down desk, please.
Yes. So it's called Levo, Levo,
all right,
and it's on Amazon.
Let's talk about the supplements first, so we don't totally confuse everybody.
I know, we're like
being like, wait a minute, can we talk about that desk?
Yeah, super helpful for that CSF leak life. But the PQQ is something that helps with mitochondrial and neurologic metabolism. So it basically supports like a healthy metabolism for those cell types. And then what was the other vitamin that someone had asked about?
Quercetin. Somebody asked about quercetin.
So quercetin and PQQ are very, very similar. Basically, quercetin is found in foods and sometimes can be taken, you know, on its own or found in foods. And quercetin acts as a mast cell stabilizer. So quercetin can be helpful for people who have mast cell dysfunction.
Yeah,
I try to get that through food with like onions, for example, which some people are like, onions are high FODMAP and high histamine, but they also contain quercetin, which can be helpful to stabilize the mast cell as well.
Yeah. Dr. Theo, the mast cell, his site is called themastcellmaster.com. He has a lot of research publications on quercetin, and also luteolin and a couple other like bioflavonoids that have been found to be very good at mast cell stabilizers.
Yes.
Are there any other certain nutrients that you found, other than the ones that you've discussed, that have been really beneficial to supplement? Somebody was mentioning that they found some research for wound healing, collagen production, bone strengthening, etc., and supplements that aid those. That being said, there's no direct research on how supplements will help EDS. And I will say that that's hopefully something that will change, and that is changing. That's something that definitely EDS Wellness would love to be a part of. Obviously, that research is really hard. I know that there's other sister organizations that are working more on the nutritional side, and I have high hopes that we will make a lot of headway on that.
I hope so too.
Yeah, and I know that Dr. Heidi Collins has spoken a lot about this. A lot of providers are talking about this. I've written about the nutritional side too, several times, even outside of EDS Wellness. I don't know that there's a ton of supplements just yet that have been studied, but hopefully we'll get there.
Yeah, I hope we will too.
Do you have
There's
any?
so many gaps in research with nutrition or with really anything from an EDS standpoint. Now that I'm an assistant professor, I have the opportunity to research. So one of the things I'd really like to do first is to do a survey on people's quality of life with EDS, because until this disease is taken seriously, and we have data on how it really does affect people and their quality of life, we won't be able to have appropriate treatment from like a traditional medical standpoint, because it's not taken seriously by a lot of healthcare providers. It's very neglected, it's very under-recognized, and people really don't understand like the degree of pain that it causes. And I think as many things are now that celebrities have EDS apparently, like hopefully it'll get more attention and basically more awareness will be spread. So
Yeah, I think it's also really important, and I, I have so many providers that I've worked with that I just love. I love all these different areas and different perspectives, and I like sharing that. I know it can be really confusing and sometimes conflicting,
right.
but just remember that while pain sucks, and there's so many different kinds of pain, and I would never say that pain is great and awesome, and
Right.
everybody should just deal with it and live with it and whatever. But pain is information. If we didn't have pain, we pretty much would die. So with that being said, I know there's so many different types of pain, and I have my own types that I can't deal with on a daily basis. But just remember that pain a lot of times is information. It's not always bad. If we didn't have pain, we wouldn't, it's protective. We would die. Immediately we would die. We wouldn't be able to go through an entire day, because the pain is information to our bodies. That's how our bodies have been trained, made, built by God or evolution to protect ourselves. So with that being said, it can go completely awry, and there's all these different types and things that can make it worse and things that can compound it. So, and while it sucks, we need pain. We need pain to give us information, for us to help. It's part of our proprioception, it's part of our input into daily life, how we learn how to move and live and how to calm down and how to what things are working, what things aren't working.
Right.
And that's really so important. So talking about, I had more questions, but while I'm looking at more questions to ask, if you don't mind, are you okay asking questions, answering questions? Okay.
Absolutely.
And
yeah.
talking about the laying down desk, talking about pain and help and input that, helps relieve pain when you're laying down, and how you know that that's working and that's good for you.
Yeah, definitely laying down helps quite a bit. It's amazing what happens when your brain has spinal fluid around it. So
what is that desk and how can we do it?
The desk is called a Levo, Levo desk. And it's, I think, $140 on Amazon. And basically it swivels, rotates. You can hook a laptop in it. And it rolls around. The base is super heavy, so it doesn't tip over. And it has a telescoping stand, and then basically a platform on it that rotates 180 degrees side to side, and also can swivel. So right now it's at a 90-degree angle, because my screen is literally above my face.
I was going to say, it's kind of like the desk that I have in front of me. That's my, standing. I don't want to say it's a standing desk, because it's a sitting down. It's this portable desk that I use.
Right.
But it's I don't know, it's got 5 different arms and I change it, but I don't know that I could be laying down on it.
Yeah, this one has a little bungee and little feet on it that don't let your laptop slide around when it's inverted. So,
and
then it comes with
a heating pad?
No, I am laying on what is called a pulsed electromagnetic frequency mat, or a PEMF mat. And basically it's used to help with circulation, because the electromagnetic frequency is a vasodilator. The caution, super duper duper caution with that, is that because it vasodilates, people that have vascular compromise should not use this. So it's contraindicated in people with vascular
with infrared, with the amethyst and different things. I think I've used one of them, or I think in fact I've asked for one for Christmas like that.
Oh, very nice. Yeah, just be really cautious, because it is a vasodilator. So people with vascular stuff, just be cautious. But it seems to help for me. This brand is called a Beamer, Bemer.
All right. So somebody mentioned and actually explained what PEA was. Okay. Somebody mentioned about a list of any kind afterwards. So I think
I've got one.
life hacks list, like we've mentioned. I mentioned the supplements list. Maybe it should be more private, versus posted publicly, just so that people understand that it's
Totally.
coming to you. So we're
Yeah,
happy to do
people
that.
can send me a DM on Instagram or send me a private message on Facebook, or you can contact me on my website in the chat box or send me an email.
Yeah, somebody mentioned, okay, salicylate has salicylic. I'm not gonna say that right now. Ice and heat are really good. Somebody mentioned some kind of intolerances that we have, that's important to make sure that we look at. PEA, great mast cell stabilizer for pain and inflammation. Okay, so here's a question. And this is coming from Facebook Live, and I have a couple on Zoom.
Perfect.
Some we can finish up in case there's any other. I have a few notes, but otherwise,
yeah, I see a few more on Zoom.
And then we'll just wrap up. But so somebody mentioned, is it normal for EDS, for people with EDS, to have canes? Let me make sure I'm saying this right. Is it normal for people with EDS to have the canes not work for numbing, or is it MCAD? Somebody mentioned that they need
like canes as in like lidocaines, procaines, that kind of stuff?
It would not work for them. They have a procedure and they're scared because they're allergic to the shots, and the canes never really numb them.
Yes, so that is a common thing with EDS people, to my knowledge. They actually, at the EDS conference in Nashville, are like doing an actual study on that. And to my knowledge, Marcaine and Procaine seem to be slightly more effective than lidocaine for people. So part of the reason is because there's two schools of thought on why we're rapid metabolizers. So one is that like the underlying fascia and lymph system, because it's slightly disordered with a connective tissue disorder, it basically like either metabolizes or carries away the medication really quickly and disperses it into a larger area, so it doesn't stay localized in that one spot that it's injected as well. So that's one school of thought. Another school of thought is that a lot of people with EDS are just in general rapid metabolizers of most drugs. So basically,
or slow metabolizers.
Or slow metabolizers of some.
So it can build up kind of toxic.
Right. And it depends on your pharmacogenetic profile. So like one thing that was super helpful for me is you can put your 23andMe into a program called Prometheus. And it costs like $10, but it basically gives you like a breakdown of your liver enzymes and tells you, like, as the result of whatever your liver enzyme profile is, how you would metabolize drugs. So for me, I found out that my liver totally lacks one of the CYP enzymes, the CYP3A5, I want to say, that's responsible for metabolizing hormones and steroids. And every time I've taken a hormone, whether it's birth control or for at one point I had a miscarriage and needed medication for that was hormonal. And then also anytime I've taken a steroid, I've had super negative effects from them. And I found out it's because I like literally just have super duper slow metabolizing of that because I lack that liver enzyme. The other thing is that I'm an ultra rapid metabolizer of most local anesthetics and general anesthetics. So like when I get procedures, I've had fentanyl in the past and it literally does nothing for me. Like it makes me constipated and that's about it. So fentanyl has zero like pain management efficacy for me at all because I'm an ultra rapid metabolizer. So it just depends on your pharmacogenomic profile. If you would rather just have a pharmacogenomic profile rather than do a 23andMe and send it through a third party and pour through hundreds of pages of data, you can do a pharmacogenetic test called GeneSight, and you can just Google GeneSight, and it's like $300. I've had a couple of patients do this, and it's been really helpful because it tells you not only the drugs that you are like potentially a good candidate for, but it also tells you and can guide like which classes of antidepressants might be more helpful for you, or which ones you should avoid, or which types of pain medicines you should avoid, or various types of like muscle relaxers, etc. So it can really help you navigate your care because you can basically skip over all of the antidepressants, for example, that like wouldn't work for you. So
yeah, that's kind of what I do. Somebody mentioned that Prometheus is Prometheus, whatever that is free now.
Oh, great.
I know that Dr. Christy Williamson also went over some of this and importance too before, and there's a couple of great articles. I have a friend of mine that's a genetic counselor, and she shares a lot of articles on like how to kind of differentiate this information and what you can really get out of it and how to utilize it versus what you should be cautious of, what to utilize,
Totally.
if I should say. So I'm happy to share that too. But I think that's really important. I love the drug metabolism testing. I think it's been one of the most profoundly helpful and protective and
Absolutely
done. For going forward. It doesn't give me a whole lot of options to be able to take, but it certainly gives me a hell of a lot of understanding for a lot of things that didn't go right before.
Right.
Okay, so we talked about nutrients. Let's see, a couple other things. Okay, two questions, they should be pretty quick. How much boswellia do you take and how often? Do you personally take and how often?
Babe, can you hand me or tell me the dose on the boswellia bottle? Sorry, I'm going to have my husband look up that one, so we'll come back to it because I don't remember it off the
while
top
he's
of my
looking
head.
that up real quick, can you talk about if you take an edible with CBD, doesn't that come up in the blood?
Sure.
Positive.
Boswellia, the answer is 450 milligrams once in the morning.
Okay.
And then for CBD, typically with the drug screen, it depends on what they're testing for, but typically they're only testing for THC, which is
so the edible has to have the THC in it for you to test positive, but it depends on what you're testing for.
That's correct. So if you did like a CBD oil, it wouldn't. The brand called Camino that I showed earlier has 2 milligrams of THC in it. So if someone were to take that, they possibly would test positive for THC.
Always be careful and maybe ask and double check.
Totally.
If you know what's in them. You okay with a couple more?
Absolutely. Yeah. I'm good now that I'm flat. Like this is my happy place. Yeah.
You sure you're okay?
Yeah.
All right. This is a great question. It's a little bit different. And I wish my husband was here too to answer this. So somebody asked, being an EDS spouse, what are helpful things I can do to support my partner from your perspective? I think the question is more of like being a spouse to somebody with EDS.
Yeah.
What are helpful things that people can do to help support their partner from your perspective?
Okay, so from my perspective, I would say that
does fully go into integrative pain management.
Totally.
I will say, because my husband has become an incredible masseuse over the years.
Wonderful.
And it is like how I deal with migraines and everything. And so sometimes integrative is people. You can't always go to the provider. You can't always depend on them. What are you going to do if you're, stuck? So.
Absolutely. So support looks different for everybody. I would say some of the things that David, my husband, has done for me from like a support standpoint is one, he's made it very clear that like he loves me unconditionally. It's not that he loves, my body. It's not that he loves like a certain aspect of me. Like he is with me to be with me unconditionally through sickness and in health. And it's not out of obligation because like when I first started dealing with this illness, I had very low self-worth and was like, you should just leave me. We're young. Like you're handsome. You'll find someone else who's like healthy. And like, I went through that whole thing. And for him basically like reassuring me like, babe, like I'm here. I'm not going anywhere. Was incredibly helpful. Also the fact that he's a fantastic listener. So sometimes one of the things that was like an adjustment in thinking for me was I'm very like fix it oriented. So if someone tells me like, hey, I feel this way, like in a pain management setting, for example, I'm like, well, here's the thing you can do to fix it. Right. And so like with mental health and like some of like the grief process around chronic illness, some of the, just harder aspects and like change in identity, mourning your past self, like there's not necessarily a fix for those things. And one of the things that David helped me realize is that like not every problem needs a solution. Sometimes like just being there to listen is super helpful. And so that's one of the things that he does amazingly well is like sometimes I just come home and I just like need to cry or I need to vent or whatever it is. And just being able to talk about it, like without saying like, we'll try this to fix it, or like, we'll try this and you might feel better, like just to be like seen and heard and understood, have been incredibly healing. Another thing is that, he, is very supportive of me in whatever I can do and never like belittles me for trying things that maybe are like out of my comfort zone. So like there's certain things that like I probably shouldn't do with a CSF leak. Like I'm not supposed to bend, lift, or twist for like 6 weeks after a procedure. And sometimes I try to do them, but he never ever like talks down to me or chastises me for like trying to do things. It's more of like, hey babe, like, do you need help with that? Or like, is there something I can get you? Or like, ask me for help. It's okay. So I think being always nurturing and supportive to me has been one of the things that has helped me feel safe, feel heard, feel validated, like as a human being, basically. And then one of the things I think from a caregiver standpoint that is important to understand, and one of the things that it's important to understand as a person with EDS, is that our caregivers can only do so much, but the responsibility to manage this illness ultimately lies on us as the patient. So for a long time, I was like resistant to acknowledging that I had anxiety that contributed to my condition. And that totally was not fair to my spouse. So there's, as much as he's been patient and supportive and like just stuck with me through thick and thin for 13 years, like there really is the onus on the patient to do what they can to manage their illness. So if there's not the reciprocity of the person with the illness, like trying to do their best to manage their symptoms, like the spouse with EDS can just offer support and continue to offer, guidance and kindness. But there does need to be, in my opinion, like the person with the illness needs to be doing what they can to manage it, and also needs to be respectful to their spouse or their support system, and not take it for granted. So I think it goes both ways.
Yeah, I think that's a great tidbit. I have 2 more questions. One is probably more involved. One of them is probably easy. Can you touch on bone broth? Using
bone broth. Sure.
Yeah, a lot of people have talked about bone broth recently in a lot of webinars. I know even a couple of providers that we've done webinars with are fans of them, which I was surprised about. But what's your take? Somebody asked about bone broth.
So I use bone broth like if I do intermittent fasting, or like if I'm doing a fast of some kind. So basically bone broth is typically pretty high in amino acids, and it can be really soothing on the gastrointestinal system. There's a place by us in Claremont called Feeling Groovy, and they have like fresh from the farm bone broth, and there's like a ton of fat in it and it's delicious. So I use bone broth just because, to my understanding, like the amino acid profile in it can be helpful in supporting collagen development and proliferation. So I think it's a great addition. I put a lot of salt in it and I enjoy it. Like I don't have like any,
again, where you get it and what's in it is important to some people.
Totally.
It's got collagen in it, and but there are different types of collagen. There's how many different types of collagen in our bodies? Like 14 different types or more.
Multiple different types, yeah.
And then that's different than what's animals. So where it's coming from and what you're trying to get out of it is important, and also what it's made of. Or do you do it? Some people do it themselves. They make their own.
Oh, nice.
Some people,
yeah, you can like stew it with like
some
chicken.
people are vegetarians or vegans, and that poses a problem. So I think there's different ways. So where it comes from is important. The last question is about sleep. There's a lot of people, and this is why integrated pain management is so important for us in a lot of ways, because you talked about calming down the nervous system, and now when we calm down the nervous system and inflammation, it really helps get a lot of our symptoms under control. But a lot of times that is really affected by sleep, and getting good sleep and REM sleep is really important, and that's a challenge for us. So
Totally.
Any suggestions for that?
Yes, and everything counts in small amounts, so to speak. So when I have patients that ask me about sleep, the number one thing that I recommend is sleep hygiene. So that means like having a routine that's consistent. So going to bed and waking up at the same time all the time, even on the weekends. I know, which is like,
I'm like, for real. I mean, I know, I get it, but like,
I know,
that's hard.
I know it's hard. Definitely avoiding like blue light or any type of electronics. That includes television, that includes cell phone, that includes tablets, e-readers, whatever. I asked one of my students the other day if they had an e-reader, and he was like, I'm not 45. Like he was like salty about it.
I was not 45.
Like it was like an old person
about it.
He was like, of course they don't have a Kindle. He was just like, taken aback that I would suggest.
Hey, that might be better for us anyway. I mean,
right. It's not blue lights.
right.
Yeah. To be young and able-bodied again, right? But basically, yeah.
It's a lot of self-discipline is what it comes down to.
Totally. Yeah. So no TV in bed, save the bedroom for the two S's, sex and sleep. And basically, avoid watching TV in bed, eating in bed, like, stay, even if you have to lay down, like, unless you're recovering from a procedure or something like that, like go outside to the couch or wherever there's like another place for you to lay down. So that way you can get exposure to the appropriate light.
From my bedroom is probably not a good idea.
Well, you're not in the actual bed, so I feel like you're.
No, I'm not. This is where I go so I can hide from my kids.
But also meditation helps a lot. So again, that channel that I use is the mindful movement, and there's some.
I wanted to write that down. Okay,
yeah, love that channel. The lady that does it, her name is Sarah Raymond, and her voice is like so soothing, and it's like perfect. Like every time there's a meditation, especially for the pain ones, I'm just like, thanks, Sarah, like for guiding me into a
There's a couple other channels that I make playlists on YouTube, on our YouTube channel, like just the music and stuff that I listen to if I'm working or something, but I didn't know about that one. That's great. I'm
a fan. And then also find out what the cause of your sleeplessness is. So if it's because you are having caffeine close to bed, or if you ate a meal within like 4 hours of going to bed, like you will have a hard time falling asleep. If there's sleep apnea, that will certainly disrupt your sleep. So you may need to get a sleep study if you suspect like that you have sleep apnea. And if you snore, you have sleep apnea. So like you have a deviated septum, but sleep apnea is just like you're not getting enough air when you breathe. One thing that has been helpful for us is like, or helps me, I think, more than my husband, because my husband struggles with insomnia as well. But a humidifier, like a cool mist humidifier, helps tremendously, especially like in the cold winter months, but just make sure you clean it so that you don't get like fungus on the filter or anything.
We have one of those too. Somebody also mentioned the Calm app. Story is really good. There's a couple of different apps. I'm a huge fan of Yoga Nidra, which is it's a type of meditation. They've based, it's not yoga. It's basically, I kind of call it yoga in the brain. But it's a type of meditation. They've done a lot of research on it. They've actually based research on like using meditation to heal trauma on it. So the I Rest program is based upon Yoga Nidra, but it's a different type of meditation. I personally find it very easy. They actually use it purposely for sleep a lot of times because of what it does to help people fall asleep and get to the REM that they need. So there's a couple of good apps. I'm a fan of a couple of them, not some other ones. It really depends on the person's voice, and it's really who you jive with. But they've been I love Yoga Nidra.
Great. I'm looking forward to giving that a try. And then I'm trying to think what else.
It's important to point about sleep apnea is huge too. That's been a huge problem that I've realized that I personally have that I had no idea.
Yeah.
I don't know why it's gotten worse lately, but
yeah, so if people have Chiari, people with a CSF leak, or people with CCI will develop sleep apnea, and that's part of the diagnostic criteria for Chiari actually is getting a study, because basically anything that's irritating your brainstem will cause sleep apnea, and that's called central sleep apnea. So that's not like the sleep apnea from like a deviated septum or like having excess weight around your neck. Like that's truly at the brainstem level. My sleep apnea was really bad, where my husband would like literally, poor guy, would like lay awake and like wake me up if I stopped breathing. So the thing
it says it's like alarming.
Yeah.
And it wakes me up in my sleep. Like I'll be dreaming and I'll have a dream that I've like stopped breathing and it's mostly on my back. And I don't know why it's so much worse now than it ever was before. But
couple of things with that. So my sleep apnea definitely gets worse when my CSF leak is more severe. I bought a thing called a Snooza Hero, and that's spelled SNUZA, and it's an auto rise monitor that they use for babies that have like SIDS, which is like that sudden infant death syndrome, or like to prevent SIDS, I should say, not babies with SIDS. But basically it's $100 on Amazon, but it has like this little thing, then you clip it like either on your bra or your underwear at night, and it monitors like the movement of your belly as you breathe. And if there's more than 15 seconds that go by, it buzzes and vibrates to wake you up. Other things that I found with the help of that snooza is that I find that it goes off more if I lay on my left side, because more of my CSF leaks are on the left. It goes off more if I lay on my left side, and it goes off more if my neck is like turned to the side, because that puts more like pressure on your neck, obviously. So basically I sleep with like a little neck roll, because pillows are like not comfortable for me. So I sleep with like a little rolled up t-shirt under my neck, and then I get a travel pillow. Babe, could I bother you for the travel pillow so I could show people like what I'm talking about? So I sleep, you know, those little travel pillows that go like around your neck, like that are a C shape like that. I sleep with a travel pillow literally around my head like this, and it stops my head from like turning way over like that in my sleep. So that way it keeps my head like in line. And when my sleep apnea was really bad, I slept with a cervical collar, like a hard collar, which is super uncomfortable. Thanks, baby. So this is how I sleep with it. I like literally put it around my head like that, and that way my head only moves like this. Thanks, baby. Yeah, and it's like, I'm sure this is a great visual for everybody watching the webinar that I've got like my fancy thing. And it's a satin-lined pillowcase because
Oh, that's good for your skin.
Yes, it is good for your skin. Yes, and it hydrates my curls. So, my mother-in-law.
All the help we can get, people. That's all I said.
Exactly. But that seems to really help. Basically, keeping my neck in appropriate alignment seems to really, really help with my like CCI and leak-related sleep apnea. So.
All right. So somebody else mentioned Insight Timer as a favorite meditation app. So a lot of people are recommending some meditation type calming apps, whether it's music or apps or whatever it is, you just kind of get into that great, good sleep hygiene that gets you into the mood, if you will.
Yeah, the relaxation
sleep and making sure that you're taking down the lights and everything. So good sleep hygiene is so important, more than, you know, it is just as important as figuring out all this other stuff too. So, and I think that's pretty much it. Thanks for answering all the rest of the questions. I think that I see one more question on here. Okay, go ahead.
Zoom. It asks about the whole 30-day challenge or elimination
the elimination diet question.
Yeah.
Like a resource.
I was totally bad about diet. Like, I'm talking like my favorite meal was Jack in the Box tacos. Like, so I was really, really bad about that and didn't have really like a clue where to start. So the company I use is called Arbonne. It's ARBONNE, and they have like a whole 30 challenge, where for a whole 30 days you cut out dairy, gluten, soy, sugar, and alcohol and caffeine. But I didn't cut out the caffeine because like that's pretty much my lifeblood. So basically cut out the other 5: dairy, gluten, soy, sugar, alcohol. And for that 30 days, you leave those out. And at the end of that 30-day period, you take one food group at a time and reintroduce it to see like which one bothered you.
You can also do the whole 30 book. I mean, if you follow it.
Yeah, there's like a whole book. That
kind of walks you through it too. So.
Right. The reason I picked the Arbonne one though, is because 2 of the meals per day are like shakes basically, that are pea protein, which peas are lectin or high in lectins. So not great for everybody, but basically 1 to 2 meals a day were like smoothies. So that was just easy for us. And then there was like a Facebook support group with like recipes and tips and tricks and like, oh, here's like a fun thing you can do with the protein and whatever. Like, that really helped. And then my mom and my husband did it with me. So it was like a fun
I've
thing.
done something similar. It's called Core Restore, which is it's a shake type thing too. That's a whole different thing. But I think there's many different ways to do it. It's just a matter of finding what works for you and making sure you don't eliminate too much, or that you watch for allergies and sensitivities and different things like that. So, or sensitivities, I should say.
Right.
All right. How are you feeling?
I'm feeling great. Yeah. Thanks so much for having me on
tonight.
Thanks
everybody let me make sure that there's no questions on Facebook. I will say, just so, because we mentioned a lot of different things and lists of things, whether it's supplements or different therapies or, you know, meditation apps or, you know, life hacks or different things. I will put together this different lists and share them. And then, like I said, this might be better. We can just email Brianna and she can get them, but we can work on these different lists to help share it to everybody. So me just make sure there's no other questions on Facebook. Thank you for everybody for joining us. Thank you, Brianna. Thank you for your time. This was like a 2-hour long webinar. So thank you everybody for being patient for us. You know, starting a half an hour later, but
yes, thank you.
An hour, and this has been in 2 hours, but just goes to show you how important, like, people want this information, and it's important to be able to share it. It's also hard when there's not a whole lot of research or information to really back it, and it's so individualized. So definitely take everything with a grain of salt, use it for your information, just recognize everybody's individual.
Totally.
You've got to do your own work, your own due diligence, be your own patient advocate, and remember that this is just informational, educational purposes only, and that this isn't to take away from anything that your doctor has suggested, stated, or that you're doing. Always do everything, or start anything new, making sure that you are under the guidance of a provider. So thank you, Brianna.
Thank you. Thanks, Kendra.
Thank you. And the mat thing, and the desk too.
Yes, I'll send those too.
Let me share those too. All right. Thank you. Okay. Bye.